So with Berg Balance scale, it is scored on a Likert scale. So there's 14 items on this assessment, and they are on a scale of 0 to 4. So 0 indicating poor balance and a 4 indicating good balance. And as you'll see in a second when I go through scoring, that it gives you more specifics of exactly how you would score a 0 or how you would score them with a level 4 or anywhere in between. The maximum score that an individual can receive would be a 56, and higher scores or scores above 45 would indicate low risk of falls, and scores below 45 would indicate a risk for falling. So low scores are bad or considered increased risk of falling, and high scores are good. General interpretation of the Berg Balance scale, it's a score from 41 to 56 would mean that the individual was independent, with, again, that cutoff score of 45 indicating a higher risk of falling. So anything from 45 to 41, although they're independent, they may still be at risk of falling. Scores from 21 to 40 indicate that they may need assistance with walking, and scores from 0 to 20 indicate that they should or are using a wheelchair. With talking about the Berg Balance scale and how it relates to falls prevention, the Berg Balance scores of 45 or below indicate that the client is at risk of falls and therefore would be appropriate for a falls prevention program. As a recreational therapist, we need to look at the full clinical picture, not just improvements in specific items on the Berg Balance scale, but instead being able to identify whether or not they are at risk of falling based off that score, and therefore finding appropriate programming for them. Exercise intervention. So the most cost-effective method to reduce the rate of risk of falls is through exercise interventions. For example, yoga, tai chi, aquatic therapy, chair exercises, or aerobics. All of those ways can help to build endurance and reduce risk of falls. The equipment that is needed in order to complete the Berg Balance scale or assessment is a chair. So it should be of medium height with a 17-inch back, a stopwatch, and a ruler measuring out 2 inches, 5 inches, 2 feet, 5 feet, and 10 feet. Some of the common definitions that you will notice in the Berg Balance assessment. The first one is minimal aid or assistance. So what does that mean? So that means that you would be able to provide verbal cues. For example, breaking the movement down into terms of body position, or potentially providing light assistance through light physical cues. This would mean that you are not assisting that person physically, but instead verbally providing assistance for them. Minimal or minor use of hands is where there are no differences between having the hands on the chair or the knees. So for example, when the client is going from sitting to standing, do they need to put their hands on the armrests to be able to stand up, or on their knees? If so, then that would mean minimal or minor use of hands. Minimal use means any pressure on the legs or chair, legs of their actual legs, like the person's legs, not the legs of the chair. And then several tries would mean that the person had to do this intervention at least 2 or more times. And then supervision means that standing by assistance, there is no touching of the client, but they are able to do this independently with the supervision or observation by the physician or by the therapist in order to kind of observe them and provide assistance if necessary, but they're more there just as a supervisory role, just observing them and checking in if they need them. So those are all of the different definitions that you may see as we're going through the Berg Balance assessment. So the first item on the Berg Balance assessment is sitting to standing. So this is one where the instructions that you'll provide are to please stand up and try not to use your hand for support. So if you're at home watching this and you want to kind of follow along and do these interventions as we go through it, or assessments, you are welcome to do them yourself. So you can stand up right now and do not use your hands for support. If the individual is able to do this without any support, they would receive a score of a 4. So they're able to stand without using hands and stabilize independently. Some key points with performing this item. So you do not use any walking aids, for example, a walker to use for assistance with standing. You want to ask the client to stand without the use of arms and watch what they do with their arms. It needs to be clear to the client to not use their arms or their hands. The starting position is usually comfortably sitting. So they would be sitting in the chair, just comfortably, naturally sitting. And then when you ask them to stand, they'll just go from that sitting position to standing. The position of the arms is sitting, or in the sitting position is hands rested on the legs. So in that seated, comfortable position, hands would be resting on the legs, but again, not being used to help them and support them in standing. Standing time is until the client is stabilized and balanced. And moderate or maximal assistance is anything beyond light assist where force is applied. So for example, a level, like if you gave them a score of a 1, this would mean that they need minimal aid to stand or stabilize. That would be putting their hands on their legs and using that to help them to stand up, or putting their hands on the armrests and using that to stand up. And then a score of a 0, which would be maximum assistance, is where they needed moderate or maximal assistance to stand. So for example, with this one, that would be if you had a gait belt on them, using that gait belt to help them to stand up, basically lifting them up and them not able to do it independently. The next question is standing unsupported. So the instructions you would provide are, please stand for 2 minutes without holding on. And you would measure this and be able to determine if they were able to do so. Also note, if they aren't able to stand for 2 minutes, how long they're able to stand. So you can see that here. A 4 is able to stand safely for 2 minutes. A 3 is able to stand for 2 minutes with supervision. So that may be like watching them, but they are kind of wobbly, potentially look like they could fall, but they don't. A 2 would be able to stand for 30 seconds unsupported. A 1 would mean that they needed several tries to stand for 30 seconds unsupported. And a 0 would mean that they were unable to stand for 30 seconds unsupported. If the subject is able to stand for 2 minutes unsupported, score full points for sitting unsupported, which is question number 3, and you can proceed to question number 4. So you can see here question number 3. So sitting with back supported, but feet supported on floor or on a stool. So if they're able to do this, then again, measure it over 2 minutes. If they were able to successfully stand unsupported, which was question 2, then you would put a score of a 4 here for question 3 and move on to question 4, which is standing to sitting. So with this one, what you're going to do is ask the client to safely go from standing to sitting down. So if they were able to sit safely with minimal use of hands, they would get a score of a 4. Some key points with performing this item: if the client asks if they can use hands, ask if they can do without hands at first. So if they're trying to sit down and they are asking if they can use their hands, see if they can do this without the use of their hands. When it says that there is the controls descent, like a score of a 3, controls descent by using hands is anything the client takes weight through their hands. So if they need their use of their hands in any way, then that would be a score of a 3. Uses back of legs against the chair to control descent is using the back of the knees against the chair. So if they use that to help them, that would be the use of the legs of the chair. Next question is transfers, or question 5. The instructions you'll provide are to arrange the chairs for pivot transfer. Ask the subject to transfer one way toward a set with armrests and one way toward a seat without armrests. So what you're going to do is have them kind of transition between one with armrest and one without. You may use 2 chairs, one with and one without armrests, or a bed and a chair. So it just depends on what you have available in your environment. But basically what they're going to do is go from one type of seating to another. So transferring one from sitting to sitting with a pivot transfer. If they're able to do this safely with minor use of hands, they would get a score of a 4. The next question, question 6, is standing unsupported with eyes closed. So the instructions you provide are please close your eyes and stand still for 10 seconds. If they're able to do this, again, by measuring it by having a stopwatch of 10 seconds, they would get a score of a 4. If they need supervision, score of a 3. If they can do less than 10 seconds, they're able to stand for 3 seconds, they would get a score of a 2. And so on and so forth. The starting position is comfortably standing, and then counting out loud is possible, but use your clinical reasoning to determine if it has an effect on the client's performance. So if you prefer, you can just silently have a stopwatch with that time. And then you want to score this based off the client's first attempt. The next question is standing unsupported with feet together. So your instructions are to place your feet together and stand without holding on. Client who physically cannot get their feet together can attempt to get as close as possible to having their feet together. If the person is doing this because of a fear, that doesn't count. It is only if it's due to some type of anatomical or physical reason as to why they cannot specifically put their feet together. And then if that is the case, you want to make sure you document that as well. If it says like one of the potential choices is needs help to attain position, that means any external support from the therapist or furniture or verbal cues is used to be able to help them to stay in that position. You can also break the movement down into individual components. So for example, get your feet close together and then document any external supports that are used or detailed instructions of how the client got into the position. The next question is the instructions are to lift arm to 90 degrees, stretch out your fingers and reach forward as far as you can. The examiner will place a ruler at the end of the fingertips when arm is at 90 degrees. Fingers should not touch the ruler while reaching forward. The recorder measure is the distance toward that fingers reach while the subject is in the most forward leaning position. When possible, ask the subject to use both arms when reaching to avoid rotation of the trunk. So basically what you're going to have them do is kind of reaching forward, as you saw in that picture earlier and in that video, and seeing how far they can reach forward without falling. This one is where a gait belt may be appropriate to prevent them from potentially hurting themselves or from falling when reaching forward. As the person who is assessing them or the therapist, you should demonstrate the movement before asking the client to do it to make sure that they understand completely what it is you're asking them to do, because this can be a little bit of a odd question to ask them to do. You want to instruct the client to choose their preferred arm and reach alongside the wall. So it could be their left arm or their right arm. For somebody who may have had a stroke, for example, there may be a side that is more that they can raise their arm to that 90 degrees, while the other arm they may not be able to. You want to measure horizontal distance with no cheats. So for example, shoulder elevation, scapular protraction, trunk rotation, diagonal reaching or dipping and stepping. And the client should choose, again, their preferred arm, but if they cannot get their preferred arm to 90 degrees, you would document the range of motion achieved and identify the reason that they were not able to get their arm to 90 degrees, because this is going to limit the distance that they can reach forward as well. And then you should also document which arm was tested. This is really helpful so that you can continue with consistency moving forward for every other time that you assess that client. So if they're using their right arm this time, you want to continue to have them use their right arm in the future. Next question is to pick up objects from the floor from a standing position. So what you're going to do is you're going to instruct them to pick up the shoe, slipper, whatever it is that's on the floor, which is placed in front of their feet. So you instruct, pick up the shoe or slipper, which is placed in front of your feet. Some key points for performing this item. So any object can be used. It does not have to be a shoe or slipper, but avoid using items that require fine motor movement. So for example, a pen, a pin, something small that would be difficult for somebody with fine or a limitation to fine motor movements to be able to pick up. Document the object used next to the item and recommend to have a prompt next to the item on the scale. So it may be appropriate to identify specifically what item was used so that you, again, consistency can use that item again. The position of the object is anywhere in front of the foot within the client's view, if it does not require the client to take a step. So it needs to be somewhere relatively close to that individual's feet, but it doesn't need to be like directly touching their feet. You want to document the technique as it provides an indication of function, also consistency moving forward. With this one, you should not be assisting the client to pick up the item by using cheats such as touching the patient's hand on the way down and seeing how far they can go, or holding onto an external support, so a chair or a table. If they need assistance, then that would, again, mean that they were unable to reach for that item without losing balance or falling. Item 10, we have 4 more to go. So item 10 is the instructions are to turn, look directly behind you over your shoulder. So you're going to turn to look directly behind you over your left shoulder. Repeat again to the right. Examiner may pick an object to look at directly behind the subject to encourage a better twist or turn. So for example, turn and look over your right shoulder towards the clock. And so they would look over their right shoulder, trying to see that clock behind them. Key points with performing this item are to look to see if neck rotation is the reason for the difficulty, or if they are able to actually rotate their trunk to be able to look over their shoulder, as the aim is to encourage trunk rotation and weight shift, not just neck rotation. You want to look to see if both sides are symmetrical and to see what the start position of the feet are facing forward comfortably apart from each other. So kind of like shoulder distance apart. Trunk rotation to be a 4 is when the client can see an object behind on the wall at their shoulder height and demonstrate both trunk and neck rotation. You want to be able to document when there are differences between the left and the right with their limitations. So maybe it's pain or stiffness that is causing them to have differences between the left and the right. Number 11 is turning 360 degrees. So the instructions tell the client, turn completely around in a full circle, pause, then turn a full circle in the other direction. So say they start from standing and they rotate towards the right in a circle, then you would ask them to do the opposite. So now from their left, go in a circle. Key points with performing this item: client is allowed 4 seconds to turn in each direction. Client is allowed to walk around or pivot, as item does not specify whether it should be walking or pivoting. Client should be encouraged to perform the task as they usually would. If they need assistance while turning, that would mean that they are anything more than verbal cues. So for example, touching would indicate that they needed assistance. If dizziness occurs while doing this item, allow the client to pause, but not sit down, as the goal of this item is to test their ability to change direction using turning 360 degrees. So that dynamic movement is what we're looking at here. If the client needs to sit down for safety or can only turn in one direction, they would receive a score of a 0. Next question, question 12. So the instructions for this one are to place each foot alternatively on the step or stool and continue until each foot has touched the step or stool 4 times. So what you want to do is to demonstrate this before you have them do it independently. You want to make sure that the step is secure, and if not, then making sure that it's put against a wall or somewhere that against a solid object so it doesn't move. For the patient's position, it is best patient position is best to one side, one arm behind, other in front, and elbows in for safeguard position. Standing slightly behind if unable. Always be prepared to support the client if they are potentially going to fall forward or backward. So this may be one where it's appropriate to have 2 people to assist that individual. The starting position of the client is for the client to stand at a comfortable distance from the start, so the client can easily reach the step, but does not catch their toe. The client is required to touch the ball of their foot on top of the step, not on the edge. Item 13, so 2 more to go. This one, you would want to demonstrate this to the subject. So place one foot directly in front of the other. If you feel that you cannot place one foot directly in front, try to step far enough ahead that the heel of your forward foot is ahead of the toe of the other foot. To score 3 points, the length of the step should exceed the length of the other foot. So it should be more than a foot ahead, like actual their foot size ahead. And the width of the stance should be approximate to the subject's normal stride width. So if they are able to touch their feet together, then they would get that score of a 4. If they're more like a stride, like they're walking, then that would be a score of a 3. Key points when performing this item. So you want to demonstrate this for the client before they do it. Tandem stance is heel to toe, both feet touching in a straight line with client's preferred combination. So it could be right foot in front of left, left foot in front of right, whatever is best. If the client assumes the position independently without prompting, it may take more than one movement. The client may score a 4. Otherwise, a 3 or 2 if the client can get their feet into a tandem stance, but with a gap between the heel and the toe. The client can adjust to a score of a 4 if, with a little bit of prompting. Otherwise, they would receive a score of a 3 or a 2. When it says foot ahead, this is when the heel of the front foot does not touch the toe of the back foot. So this would be more than 1 foot ahead of the other one. And then a small step would mean a step with a length less than a foot. Item 14, the last item on this assessment. So instructions: stand on one leg as long as you can without holding on. Key points when performing this item. So the client is to choose the preferred leg and record first try. Legs can touch, but are not allowed to lock their non-weight bearing leg around the stance leg. So just keeping that in mind, but basically just standing with one leg wrapped around the other. Some intervention guidelines, and I'll provide these for you as well, but say that the individual had difficulty with standing unsupported. Some possible impairments, this could be poor gaze stabilization, low limb weakness, abnormal weight distribution. And so specific recommended exercises that may be appropriate for this specific area would be to teach gaze fixation and stabilization techniques, to help them through wall sits, lower limb exercises with resistance, and center of gravity standing balance. And so I'm going to provide this for you all, but I think that this is really interesting and would benefit you when completing your documentation, to be able to have recommended exercises based off of areas that need improvement for that individual. So there is multiple slides, as you can see here, of items, but this is also going to, be in Canvas as well for you to review. All right, if you have any questions, please let me know. Thank you.